Well, there's been an interesting development since I put most of this video together, and that is one of the Medicare Advantage companies, starts with the letter A, but I won't name them here, have completely pulled access to their provider directory online. So you as the client cannot search it to see what providers are in there. We as the producer cannot search it, and it's completely offline because you can't see anything unless you're on one of their special needs plans, because that is who they want business from. Why? Because the special needs plans with Medicare Advantage pay the health insurance company a whole heck of a lot more than regular Medicare Advantage. This year, the profit motive with these companies is absolutely stupidly, horrendously awful. It's unbelievable what they're doing to clients, what they're doing to their existing client base, their patients, and to the agents as well. Hiding plans, restricting access. We can't even get access to the applications to get somebody on that plan. They already took the commissions away from the agents a long time ago. And now they're hiding the provider directory unless you're on the plan that makes them the most money. It's absolutely sick. But I digress. I'll get into it.
Patients rely on provider directories from Medicare Advantage insurance plans to find in-network providers. However, many insurers fail to update these directories, creating ghost networks of providers who are listed as options for care despite no longer practicing, no longer accepting patients, and are not part of the plan's network.
So our investigators looked at a cross-section of mental health plans across the country. They contacted the providers. They asked if they could get an appointment for a family member. They were able to get an appointment 18% of the time. So more than 80% of the time, their plan actually failed them. Even if a senior could make an appointment with provider and get this, they may be exposed to extra costs if they have to go to a provider out of network. In other words, they paid for something, there wasn't any service, they need some health services, they go out of network, and the person they gave the money to originally sticks them with the second bill.
The confusion that can arise from ghost networks can result in delays in care, inappropriate treatment, and unnecessary costs for patients who unknowingly visit out-of-network providers. Dr. Miller, in your testimony, you explicitly mentioned ghost networks, and I appreciate that. You argue that directory reform would bring Medicare Advantage plans closer to the private market.
Every year around this time, millions of Americans on Medicare are flooded with mail, ads, and calls telling them to compare their plans. It can be overwhelming, and a lot of people just give up and stay where they are. But doing nothing could cost you real money next year, or even limit which doctors you can see. One area that's caused growing frustration is how unreliable plan information has become. Some of the largest provider directories in the country, including those on Medicare's own website, have been shown to contain large numbers of errors, duplicate listings, or outdated doctors who aren't even accepting patients anymore. These aren't small mistakes. They can lead you to pick a plan thinking your doctor is covered, only to find out later that they're not. Part of the effort to fix this came from the Consolidated Appropriations Act of 2021, which included the No Surprises Act. Most people know that law because it banned surprise medical bills, but it also created new requirements for commercial health plans to keep their provider directories accurate. Those plans now have to verify every listing at least once every 90 days and update their directories within 2 business days when a doctor or hospital reports a change. However, that part of the law doesn't directly apply to Medicare Advantage. Federal agencies clarified that the No Surprises Act's directory rules only apply to private employer and individual market plans, not Medicare, Medicaid, TRICARE, or the Veterans Health System. Medicare Advantage plans have their own rules from the Centers for Medicare and Medicaid Services. Under CMS regulations, plans must maintain accurate directories and make corrections within 30 calendar days through what's called a Provider Directory API. So while the intent is similar, the exact timelines are not. In 2022, Congress introduced a bill called the Real Health Providers Act that would have expanded the 90-day verification and 2-day update requirements to Medicare Advantage plans. That bill never advanced, so the existing CMS standards still govern those directories. Many Medicare Advantage organizations are following the stricter timelines anyway because they've been under pressure from the Office of Inspector General and from Congress to clean up their data. What this means for you is simple. Don't assume that the plan directory or even Medicare.gov is always accurate. Before you make any decisions, take a few minutes to verify directly with your doctors and hospitals. Ask if they will still accept your plan in 2026. Offices drop and rejoin networks all the time, and those changes often don't show up right away online. While you're checking, review your prescription coverage too. Formularies can change every year. Log into your plan's member portal or call the number on your card to confirm that your medications are still covered and haven't been moved to a higher cost tier. If you're in a Medicare Advantage plan, look carefully at next year's evidence of coverage and annual notice of change. Pay attention to hospital coverage, co-pays, and out-of-network limits, especially if you travel or split time between different parts of the country. If you find anything that doesn't look right, call the plan directly, and if you see a provider listed that turns out not to be a network, report it to 1-800-MEDICARE. Those reports help federal regulators track which plans have ongoing directory problems. The bottom line is that the government has recognized how serious the directory accuracy problem is, and even though the strict No Surprises Act standards don't yet cover Medicare Advantage, you can still protect yourself by double-checking everything now. Being proactive for just a few minutes this fall can save you from major surprises next year.